So we will start from here. So it's regarding the nutrition at various developmental stages. അതായത് സംസാരിക്കാതിരിക്കുക ആവശ്യത്തിന് സമയം തന്നിട്ടുണ്ട്. Okay. So various developmental stages means we have to study what are the important types of nutrients which are needed by the body mainly at three stages. One is during infancy, then we have to understand during the nutritional requirements during pregnancy and lactation. The previous syllabus you have to study the nutritional requirements at various stages like preschool, adolescence, old age, etc. Now that has been removed. So fortunately, you need to study only the nutritional requirements of three different stages. To begin with, we will start with the infancy. Infancy means early age. And the period from early age that when the baby is born, 4 to 3 years, that period is known by the name infancy. So infant nutrition is the description of dietary needs of infants. Infant simply means babies. That is the meaning of the word infants. And diet lacking essential calories, minerals, and vitamins or fluid is considered inadequate because even for a baby they are requiring many different types of nutrients, especially they are requiring glucose is needed and milk proteins are needed. Along with them, sufficient quantities of minerals and vitamins are also required. Normally, the infants are feeding breast milk, and the breast milk is prepared in such a way that it contains almost all the nutritional requirements of the baby. So for a period of up to 6 months, child needs only breast milk. So breast milk provides the best nutrition for these first months of growth. Now, as I told you, during the first 6 months, child does not require any other kind of nutrients. What is the samsarikala back? Okay, so for example, the breastfeeding helps in preventing anemia. Anemia simply means a lack of blood, and that means if if food is not containing sufficient quantity of iron, that will prevent the formation of hemoglobin, and that means there is a inadequate amount of blood. So one example of benefit of breastfeeding is that it prevents anemia in children, and it also prevents obesity because if you have noticed the babies which are fed with artificial milk or the now the milk powder, they will be very obese because they look very healthy. They look physically they will look very chubby or very healthy, but actually they may not be very healthy. So the milk powder is creating a situation of too much fat in the body, and that will be leading to obesity in children. Another problem is that sudden infant death syndrome. Now, sudden infant death syndrome is a situation in which the sleeping baby may die without any kind of cause. Such a situation is known as sudden infant death syndrome, and we don't know exactly what is the reason for that. But babies which are feeding mainly breast milk, do not have this problem because breast milk also contain many antibodies. Maybe these antibodies may be offering some kind of protection. That is why doctors always advise, even in most of the hospital, they are now baby friendly hospital. You can, if you go to hospital, there may be some board like baby friendly hospital. That means that they are promoting breastfeeding. So breastfeeding is the best method or best kind of food that infant needs. So it also promotes digestive health because when you are giving milk powder, the problem is that the stomach of the child that is not suited for accepting the cow's milk. There is a slight difference between milk produced by a cow. It is actually produced by the babies of the cow. When human baby is drinking that cow's milk, that may not be adequate, or that may not be completely suitable for the digestive system of the human baby. So that will result in some kind of stomach or intestinal problem or stomach related problem. So that is why digestive health is important. Then immunity and as well as intelligence. Immunity means the breast milk contain lot of antibodies. So a baby who is mainly feeding on breast milk may not have any kind of diseases during that period. Normally, if you are closely observed, when you have a baby, you may be easily noticing that during the first 6 months, if you are feeding only breast milk, there will not be any problem. Most of the time, you will be visiting hospital after the 6 month when you have started introducing semi-solid food. Because even if you take as much care, there is a high possibility that bacteria can enter into the feeding bottle or the bowels or glasses that you are using for feeding the baby. So that is how the bacterial infection, especially bacterial infection of the stomach, and most of the time diarrhea or dysentery or vomiting, these are the common problems which are affecting the babies. And the most important reason for such diseases are actually the bacterial contamination of the food. So that is the main. So in the use of breast milk, there is no such thing. There is no bacterial contamination. Then another problem is the intelligence. So, because the feeding process is actually developing a close interaction between mother and the baby, and that is also promoting the intellectual development of the child. So, that is why breast milk feeding has several advantages. It is good for immunity, it's good for the intellectual or intelligence of the baby, and it is good for the digestive tract of the baby. So, that is why all the hospitals are now promoting breastfeeding. Now, American Academy of Pediatrics recommends exclusive feeding an infant breast milk or iron fortified formula for the first 12 months of life. That means they are saying that for the 1 year, there is no need for introducing any other kind of food. But normally, in our country, after the 6 months, slowly we are introducing, because the problem, most of the mothers are working, so it may not be always possible to give breast milk for the first 12 months. So that may be the practical reason why in our country, because in there are if you go to European countries, there the maternity leave is for 1 year or 2 years. Here it is only 6 months. So after 6 months, if we are not introducing semi-solid food, practically it will be creating lot of problem. So even for the first 12 months, the child can survive without any other kind of food. So if that is possible, that is the best method. So infants are usually not introduced solid food until 4 to 6 months, because introducing the solid food is always a risky thing. We have to take a lot of protection, lot of care. So breast milk is rarely contraindicated. Contraindicated means there are very few situations where doctors say you should not give breast milk. So that is, but it's not recommended for mothers treated for cancer, because in the use of cancer treatment, there may be some radioactivity, radio treatment, radioactive treatment may be given. So the mother may have some radiation that can also affect the baby. That is why, in the use of cancer or patient undergoing radioactive treatment, that should be avoided. And those with the active tuberculosis. Tuberculosis is a very common type of disease, and maybe in around 40% of the people, this bacteria is there. But in most of them, there won't be any symptom. So those patients with active or tuberculosis should avoid breastfeeding. Then HIV, in the use of HIV, there is also HIV is a virus that can be transmitted through any kind of body fluid. So there is a possibility. Then substance abuse, like alcohol abuse, that is also that alcohol can also enter the milk, and the child can also get alcohol syndrome. Then leukemia means a kind of blood cancer where there is increased multiplication of the WBC. So these are the, except all these kind of diseases, there is no other disease. And most of the in the case of most of the diseases, the mother can breastfeed the child there without any kind of problem. Then here you can find a situation. But now most of the time what happens is that when you are introducing semi-solid food, from the spoon or from the plate or from the hands, there is a strong possibility that child can get bacterial infection. So that is the main problem of introducing semi-solid food. Semi-solid food always pose a risk. The risk is mainly bacterial contamination, and that bacterial contamination can affect the stomach and causing diarrhea or vomiting. So this is the most common type of problem children, babies are having. Now, the proper infant nutrition demands providing essential substances that support normal growth, functioning, development, and resistance to infection. Here also WHO has given. WHO and the Pan American Health Organization recommend feeding infants only breast milk for the first 6 months. So that is why generally we can take it into a consideration that during the first 6 months of the baby's life there is no other food is needed. If the infant is being fed formula, it must be iron in. Sometimes there are situations, for example, already we have seen there are cases where the mother is having cancer. In such a situation, the it may not be possible to give breast milk. In such a situation, the best milk is the iron fortified. That is a milk powder which is enriched with iron, because iron is an important mineral, because in the absence of iron what happens is that the development of hemoglobin may not take place. So in the absence of hemoglobin what happens, transport of oxygen and carbon dioxide will not occur properly, and there will be anemia. So these are the problems of giving milk powder. So in such situation we have to take extra care of giving iron fortified milk. An infant that receives exclusively breast milk for the first 6 months rarely needs additional vitamins or minerals. So that is another advantage, because breast milk contains almost all the milk, all the nutrients, all the requirements. There is no need for providing any kinds of other vitamins or minerals. When you start introducing infant formula or milk powder, milk from the milk powder, you have to make sure that child gets sufficient quantity of vitamin. That is why you might have noticed that mother sometimes gives multivitamin drops to children. This might that is necessary. That becomes as a necessity, because the cow's milk doesn't contain all the vitamins or minerals needed by the baby. However, vitamin D and B12 may be needed if breastfeeding mother does not have proper intake of these vitamins to prevent the deficiency of rickets. Because vitamin D as well as vitamin 2, B12, these vitamins are very much important in the development of in the formation or utilization of calcium. So, in the absence of these two vitamins, what happens is that the calcium the calcium intake may not be taking place properly, and your bones as well as teeth may be development of bones and teeth may be affected. So that will lead to a situation on by the rickets. So rickets are normally caused by the deficiency of vitamin D and vitamin B12. Exclusively breastfed infants will also require an iron supplement after the 4 months. So because iron is depleted at this point from breast milk. So even if you are introducing breast milk up till 4th month, there is no need for any kind of other food. But from the 4th milk, the amount of iron that will be available in the mother's milk or breast milk will gradually decrease, and that makes it necessary that after that it becomes necessary that you have to start introducing the multivitamin drops for the children. That is the meaning of that sentence. Then health professionals recommend that breastfeeding begin within the first hour of baby's life and continue as often and as much as baby want. And why this is important is that normally there is a process called imprinting, and in the use of animals and birds, this imprinting is very strong and very much irreversible also. But human being more intelligent, are not that much addicted, that much strict on imprinting. The reason is that the child is identifying the mother during the first few hours. Even that after the during the first few hours, the child can recognize the mother by its smell, and the smell of the mother can be easily identified by the child. So that is why, in order to develop a close emotional bonding between the child and the mother, the breastfeeding is promoted right from the very first hour of pregnancy. Sometimes some women may have some problem, but still most of the women can produce milk even immediately after the pregnancy. During the first few weeks of life, babies may need roughly 2 to 3 hours. That means how much amount of time. That is approximate. That gives you an idea. 2 to 3 hours in a day. So that the first few weeks, that is the case because they need more milk during that time, and the duration of feeding usually is 10 to 15 minutes. So how much time and how much duration you should feed, that also, yeah, that gives you a rough idea. Now, older children feeds less often because they are feeding on other kinds of semi-solid food. So they don't need to feed on mother's milk too much time. And mothers may pump milk so that it can be used. And there is a device which is available in the medical shop called breast pump. It is a small device because what happens is that when you are working, maybe when you are a working woman, it is not always possible to feed your baby properly. Maybe leaving the house at 7 o'clock or 7:30 in the morning and coming back at 6 o'clock. Then the child may be taken cared by someone else in your house, maybe mother or somebody else. In such situation, child still needs milk. So that is one possibility that you can utilize is the using a breast milk, collect the milk from the breast and keep it in a refrigerator and give it to the child when using a bottle. So breastfeeding has number of benefits because giving the child breast milk is the best method. If you are giving breast milk, the child may not be having any kind of disease. Now, most of the time, if you are when you are start working, and if you are not normally in most of the time, if you are getting a job, the salary is around 20,000 to 30,000. If you go to a private company, that will be the amount of that will be the salary most of the time you are getting. If you get a government job, it may be 30,000 plus or 40,000 plus. But in most private companies, that is the range of salaries between 20,000 to 30,000. Some places it may be much less. Now, if you have a child and the child is getting an infection or a disease every month, what will be? You have to take the child to the doctor, and most of the time, visiting a doctor means 1,000 or 2,000 rupees. Now, if you are getting only 30,000 salary, you have the we have to visit the doctor every month or every month. That means a lot of money will be wasted on this medical expenditure. So this is a problem everybody is facing. So as far as possible, take enough precautions so that this kind of unwanted disease can be avoided. Then breastfeeding has number of benefits to both mother and baby, which infant formula lacks. So we have already seen what are the benefits of the breast milk. Deaths of an estimated 8,20,000 children under the age of 5 could be prevented globally with increased breast milk. Even though breastfeeding is so much important, in many parts of the world, breastfeeding is still not that much popular. That is why around nearly 8.2 lakhs children are dying because of the lack of adequate breastfeeding. So that is an important. That is why still the WHO, government, and everyone is telling that people you should breastfeed your children because by a simple method you can avoid a lot of diseases. Breastfeeding decreases the risk of respiratory tract infection like allergy and diarrhea. So, and both in developing and developed. So, that is another advantage. So, if you are introducing this infant formula or milk powder, the problem is that you are taking more, you are creating more trouble for the children and also for the family. Because economically, if the child is having some kind of disease, you have to spend more amount of money on medical expenses. So that is the problem. So wherever possible, I to avoid milk for milk infant formula, and as much possible resort to breastfeeding. Now here you can also see some of the benefits of breast milk, because breast milk is the best food for newborn and young babies. There are number of reasons. It provides all the necessary nutrients. All the nutrients are there, vitamins are there, minerals are there. Second is that it is safe and it is always available. Then it doesn't need any kind of preparation, because as I have already shown you, during this preparation of the food, bacterial contamination or bacterial entry will be always taking place. We can, even with the best precaution, it is very difficult to avoid. Then another advantage is that it contains antibodies. So these are some of the advantages of breastfeeding. Then breastfeeding is also good for the mothers. Now, what are the advantages? Because normally during a pregnancy, the mother may be having an extra weight. That extra weight has to be low, has to be gone, or has to be low, has to be removed from your body immediately after the pregnancy. Otherwise what happens is that you will be keeping that weight for a long time, and that weight naturally becomes part of your body. So best method is that because this when you are breastfeeding, this extra fat that has been deposited will be utilized by your body for the production of milk, and gradually your weight will come back to the original weight. So for the mother, that is an important advantage. Then it reduces the risk of type 2 diabetes and breast and ovarian cancer. Now, recently we know that this ovarian cancer as well as breast cancer. Breast cancer is not that common, but still problems with ovary or a uterus is very common. If we have, you may have such experience in your family, either mother or grandmother or someone older. In almost all the families of Kerala, most of the women are having some kind of problems in the uterus or ovary, and most of the time that needs an uterus removal operation. So this ovarian cancer as well as uterine cancer are quite common, and the breastfeeding can reduce the incidence of this cancer to a large extent. Then another problem is that development of anemia. Anemia for the mother can also be reduced by practicing breastfeeding. So this is the advantage. These are the advantages which are benefited by the baby as well as by the mother. Now we go to the second area, that is the nutrition during pregnancy. What are the type of food that a person or a mother should take? അവിടെ സംസാരിക്കാം കേട്ടോ. Approximately 300 extra calories are needed daily to maintain a healthy pregnancy. So that shows that the mother needs more amount of nutrients during the time of pregnancy. That will give you an approximate idea how much extra food you should take. That means whatever food you are eating daily, you need an extra calorie of 300. Now, these calories should come from a balanced diet of protein, fruits, vegetables, and all grains, seeds, fats, etc. And mainly from this should come from proteins and fruits and vegetables. As far as possible, fatty food and also seeds, they should be kept to the minimum. That should be reduced. A healthy, well balanced diet during pregnancy can also help to minimize some pregnancy symptoms like nausea and constipation. That is two common problems women are experiencing, especially during the first 3 months of pregnancy. Most of the women will be experiencing nausea. For some women, it may not be. It may be a short period. For some, it may be lasting for several weeks also. Nausea, a tendency to vomit or okanam, മലയാളത്തിൽ അങ്ങനെ പറയാം. Then that nausea it's a bad because if you are vomiting, that makes you tired too much. Another problem is that constipation. Why constipation is taking place? Because when uterus is developing, uterus is enlarging, that will be pressing on your intestine as well as rectum, and that will also create a problem of constipation. Then there will be the amount of water available in the intestine, especially in the large intestine and rectum, will also be reduced. That also result in constipation. So constipation is a process. So in order to avoid constipation, the mother should eat enough amount of fruits and vegetables. Otherwise, these kind of problems will be troubling you. Academy of Nutrition and Dietetics recommends the following key components of healthy lifestyle during a pregnancy. One is appropriate weight gain. That means normally a normal woman, if she is 55 kilogram, she should be at least 10 to 15 kilogram. The weight should be increased by 10 to 15 kilogram. If that body weight is, if that gain in weight has not been reached, there will be problems. So that is the appropriate weight gain around 10 to 15 kilogram, in an increase of 10 to 15 kilogram. Then eating a balanced diet. So this is also important. Why they are stressing is that sometimes when you are many women are pregnant, they naturally you get chocolates and other thing or ice creams or other thing. If you are eating these kinds of thing, these kind of food items, problem is that it will only increase your fat, and it is not going to give you the nutrients or proteins or minerals or vitamins needed by your body. So you look fat or chubby. At the same time, your body may not be having sufficient minerals or vitamins. Then exercising regularly. That is another important thing. So regular exercise is also important. So the because if you are not practicing regular exercise, the problem is that the trouble caused by pregnancy can be felt by your body at a higher level. There may be back pain and other kind, because as the baby is developing, then extra weight will be coming to your back, and that can cause back pain for many women. Then appropriate and timely vitamin and mineral supplementation. And here why I am mentioning and is that I think we will come to that. There is a kind of vitamin known as folic acid, and this folic acid is very much important during the pregnancy. If there is a lack of folic acid, that will be resulting in a lot of different type of diseases. Then fluid intake. Fluid intake means drinking water. If you are drinking, you have to drink enough amount of water during the nutrition. Then women can take enough fluid by drinking several glasses of water each day, in addition to fluids in the juices and soups. So, because the problem is that a lot of water is also utilized by the child, and also for maintaining the pregnancy, extra water is needed. So, if you only drink the water that you used to drink at the normal level, your body may not be getting enough water. And alcohol should be avoided. All alcohol should be, because the problem with alcohol is that alcohol can also enter the uterus and also reach the baby, and baby can also get this alcohol syndrome. So the fetal alcohol syndrome, there is a kind of disease that will be affecting the baby present in the inside the uterus. The US Public Health Service recommends that all women of childbearing age consume 400 microgram of folic acid. That is why folic acid is a very important mineral, vitamin, and it needed to reduce the problem of neural tube defect, because in the absence of this vitamin, that will be affecting the development of brain, especially the brain and the spinal cord. Because for the normal development of neurons in the baby, these vitamin is very much important. If you notice anyone at home who is pregnant, you can see that they will be daily taking a tablet. Most of the time it will be folic acid. So folic acid is the main tablet that is given by the doctors during the time of pregnancy. Purpose is to avoid this problem, especially problems with the brain and spinal cord. And this can lead to, if there is a deficiency of folic acid, that can lead to varying types of paralysis. Paralysis means the തളർന്നു. That's the meaning of the that incontinence, and sometimes incontinence means inability to control urination. That is mean the meaning of the incontinence, and also lead to intellectual disability in the child. So that is why taking enough amount of folic acid is very much important. Now, folic acid is most beneficial during the first 28 days. That is, when the child is born, and up to 1 month, the intake of folic acid is very much important. And it is during this time the neural defects are normally developing. So, doctors always say those who have a plan to become pregnant should always take folic acid before pregnancy. Otherwise, what happens is that most of the women may be going to hospital after 28 days when the menstruation or baby stops. Then the first month of the pregnancy may have been completed. So neural defects most of the time develop during the first month of the pregnancy. So there is not much benefit of taking folic acid after the second month. So that is why doctors say that if you have a plan to become pregnant, take folic acid before. Unfortunately, most women do not realize that they are pregnant before 28 days. So that is the reason. So taking folic acid should begin prior to the conception, prior to the pregnancy, and continue throughout the pregnancy. So that is the advantage of folic acid and importance of folic acid. Here also they are showing some of the important kinds of food, of vegetables that should be taken during the time. You can also, these are all common vegetables which are present in our area. So any kind of vegetable should be taken during the pregnancy, and because vegetables will give you enough amount of some, I'm sorry, it will give you enough amount of fiber, and that fiber helps you to prevent constipation, and vegetables also give sufficient quantities of vitamins and minerals. Now we have two other types of okay. Then there are two different types of minerals are there. I think I will be discuss, and one such mineral is the iron. If you take the iron is very much needed by your body. The reason is that iron is needed for the development of RBC or hemoglobin. So this baby is also developing. Baby is also producing extra blood, and a lot of iron is also thereby needed by your body. So daily recommended dose of iron during pregnancy is 27 mg. So then extra amount of iron rich food. And what are the food items which are giving you iron? One is a red meat. Second is poultry, chicken. Then fish will be giving you. Then dried beans, peas. Then iron fortified cereals. Then prune juice. So these are the kind of food that gives you iron. So intake of iron is very much important. Similarly, another mineral is calcium. The calcium is needed for the development of bones and also for the development of teeth. So all women, including the pregnant women, aged 19 years and older, should get 1000 milligram of calcium daily. So if there is a deficiency of calcium, that is going to affect the development of bones and teeth. And those here it shows the how much amount of calcium is needed by a woman. So if you are 18 plus, daily minimum 1300 milligram of calcium is needed. And milk and other dairy products such as cheese and yogurt are the best sources of calcium. So from where you can get calcium? Mainly by drinking milk and milk products. These are the main sources of calcium. This cheese and yogurt are also related with the milk. So if you have trouble digesting milk products, you can get calcium from other sources like broccoli, dark or leafy greens, sardine. This sardine is containing lot of calcium, or you have to take calcium supplements. So these are some of the food items that shows you rich in calcium. Here also you can find this red meat is there, the eggs are there, nuts are there, tomato is there, then shellfish is there. So these food items will give you, or leafy vegetables, all leafy vegetables will give you enough amount of iron. Then coming to the last one is the vitamin D. Going to the vitamin D, an extra intake of 600, keep right, in 600 international unit of vitamin D is needed. And the best source of vitamin D are milk itself. Milk fortified with vitamin D, such as fatty fish and salmon, and also exposure to sunlight also convert a chemical in the skin to vitamin D. So that is why when if you are exposed to vitamin sunlight, sufficient amount of sunlight, development of vitamin D will be taking place. If you have normal weight before pregnancy, you should gain 25 pounds. 25 pounds means around 12 kg divided by 2 to 35 pounds. You can say around, you will get 17. So 12 to 17 kilogram should be that should be the increase in weight during the pregnancy. Here you can find some of the food stuffs which are rich in calcium and also vitamin D. You can find almonds. You can find, and all these foods are very costly. If if you have a habit of purchasing almond, you know what is the price of that. And if you are underweight before pregnancy, you should gain more weight than a woman who has. That's normally during a pregnancy 12 to 17 kilogram. That is a recommended weight gain. So if you are underweight before pregnancy, a very simple way of measuring weight is that if your height is 155 centimeter, you should have a body weight of 55 centimeter. 55 kilogram. If your height is 160 kilogram, 160 centimeter, your body weight should be 60 kilogram. So that way you can measure what is your ideal weight. So if your ideal weight is less than normal, you must start taking more amount of food in order to maintain a normal trouble-free pregnancy. So overweight and obese women are at an increased risk of several pregnancy problems. These include gestational diabetes, high blood pressure, preeclampsia, preterm birth, and cesarean delivery. So these are some of the problems which can be avoided if you are maintaining a normal, healthy pregnancy. Now we will be going to the lactation and other in the next class. Today we will be stopping here.